Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today in this podcast, I want to go over what I would call advanced Botox. I'm going to go over Botox to off-label areas that are not FDA approved, and also what are the differences, if any, between the various toxins that are FDA approved. So a brief reminder, if you want the primer on Botox basics and what it does, there is a whole other podcast episode on Botox basics to listen to. But for today, I'm going to focus on what I would consider advanced Botox. First, I'd like to discuss off-label areas for Botox. As a reminder, Botox is FDA approved for the glabella, or the area between the eyebrows, the forehead, or the frontalis muscle, and the crow's feet on the sides of the eyes. A long time ago, before Botox was even FDA approved for cosmetic use, many dermatologists were using it to treat wrinkles on the upper face, and I had an idea at that time. So many people complain about the tiny lines underneath their eye, and if Botox works for other muscles and lines, then why not there also? So I tried it in tiny doses on myself and staff and patients with their permission, and lo and behold, it worked great. So for many years now, I have used Botox underneath the eye on myself and many others, including many patients, but it's tiny dosing, and it works great to smooth out the scrunch of the orbicularis oculi muscle underneath the eye. Now, not everyone is a candidate for this. If the patient has loose skin, or lines underneath the eye that's from the cheek lifting up but not the actual muscle, then Botox would not be helpful. Also, patients who have an under-eye bag are not great candidates for Botox underneath their eye, as the muscle is helping push down the bag, and we could make the lines better with Botox, but the bag will be worse, so it's not worth doing. So as you can see, there's a lot of nuance and decision-making to figure out who is a good candidate for Botox anywhere, particularly underneath the eye. And also, there are some patients who do not like to do things that, as we call it, off-label or not FDA approved, and that is fine. Don't have to do Botox underneath the eye, no problem. However, for the right candidate, the Botox under the eye is really helpful. It helps open the eye a little bit. It makes the skin smoother. The small dose, however, means that it does not last very long, and the sensitive skin there means that it's very likely to bruise when I do the injections. However, I love it for so many people, myself included, that I do it frequently. This is definitely for an advanced injector. The typical Medi-Spa injector is going to be afraid to do this, as the usual rule is do not inject Botox within the orbital rim. But as I will tell you, I've been doing this for way over a decade and have had no problems with it at all other than bruising, and it makes a great difference for many, many patients. Sometimes it makes it a little bit harder to squint, so I do recommend to wear good sunglasses, which is a great idea anyway to protect the eyes from UV radiation. So another area of Botox that is off-label that I love to do is the chin. I do this on probably almost half of my Botox patients, and they never come in asking for it. But while I am talking to them, I notice that their chin gets all scrunchy as they're talking. And again, like the under eye, I tried a little Botox and voila, smooth chin. So patients ask me, why do this? They don't even know that they have a problem there. And I tell them that it will prevent the orange peel chin from happening to them later. If you just let your chin continue to scrunch all day as you're talking and chewing, you'll eventually get bad lines there, and those are hard to treat. So it's really preventative for a lot of patients. But it also works really well for patients where their mentalis muscle of their chin scrunches their chin up so high and so much that those are the people that come in thinking that they need chin fillers or a chin implant. But all they really need is for the muscle to relax, and it will drop down and look like a nice, smooth chin. So with chin Botox, you do have to keep it up constantly, like all Botox. And while fillers last longer, they do address different issues, particularly in the chin. If someone needs chin filler, that's fine, but if their muscle is strong and filler is added without Botox, they will now have a bigger chin that is still wrinkly. So I'm constantly doing chin Botox, and I doubt this will ever get FDA approved because it's just a few units, and I can't imagine that it would financially make sense for Allergan, the Botox company, to do the FDA trials to get it approved for such a small dose. I doubt the finances make sense for them, but I absolutely love Botox in the chin, my own included. The next off-label area I'd like to discuss is the masseter muscle of the jaw and lateral cheek. And this is probably going to be FDA approved very soon for facial slimming, but it also works very well for TMJ and to reduce clenching. And the dose that I use really depends on the size of the muscle. Some people, they have these giant masseter muscles and they need a high dose. Most people, it's strong, but not that strong. I can do a medium to lower dose. We don't want to overdo it as you need that muscle to chew and to talk. But if it's a very strong muscle and causing trouble, weakening it with Botox is very useful, and I have lots of happy patients who love it to reduce their clenching and TMJ, and sometimes it slims the face a bit, although mostly I do injections in that area for patients who want it for pain relief. And while I do not actually treat TMJ with their permission or with their doctor, their TMJ doctor's permission, I will put Botox in their masseters. Now I'd like to discuss the neck. Botox works great to reduce neck bands, and also sometimes the little wrinkly skin that happens on the neck if it's muscle related. So this is also an area that's probably going to be FDA approved sometime soon. And the main downside of doing Botox on the neck really is some bruising when you do it. And then occasionally it's hard to do sit-ups or crunches or Pilates if your frontal neck muscles are very weak. I've never really had a patient complain about this, but I have noticed it sometimes on myself. So the neck, it works great for neck bands, and if patients want to do it, great, I'll do it. Maybe it will be FDA approved sometime soon. I'd like to mention two things that I don't do. The first one is trap tox, or Botox for the trapezius muscle, that became a social media sensation after the Barbie movie, since people wanted that long, slender Barbie neck, and I guess some people are injecting Botox into their trapezius muscles to get that effect. I do not do this. It's a lot of Botox. It's a big muscle that you would need to reduce that muscle. I feel this is not something that I'm interested in this time, and it's just not something that I do. And I really don't have a lot of patients asking for it, so I don't really have much commentary on it. And then I'd also like to mention the Nefertiti lift, which is Botox along the jawline. And this was a thing many years ago, and it kind of disappeared. And for some reason, probably due to social media, it's all of a sudden popular again, and people are asking me about it all the time. And while I don't think it's unsafe, I just don't think it does much. So I like to stick to things that have really nice results, and I just feel that it doesn't do all that much. So I tend not to do a Nefertiti lift with Botox. And if we are talking about issues with the jawline, I'm usually talking more about fillers or oral therapy, or does the patient need a facelift, which again is something I don't do. I would refer out for that, but I don't find that Nefertiti does much, although I also don't think it's harmful. I will have an episode coming out on jawline rejuvenation soon. And I don't want to forget to talk about Botox lip flip. I really hope whomever coined that term got paid for it. They probably didn't, but it took off like wildfire, and I've been doing Botox to the upper lip and generally to the lips for many, many years, and it was never called Botox lip flip. But it's a very catchy phrase, and people ask for it all the time. The Botox weakens the orbicularis ori muscle around the mouth and can help reduce lines and lip wrinkles and lip pursing, and the result can slightly evert the lip, making a subtle but nice change that some people love. The issue here is that we have to use very small doses because, again, we need this muscle. We need the muscle to eat and to talk, so we can't knock it out like we can with the crow's feet, for example, or the glabella. We don't need to frown. We don't need to crinkle our crow's feet, but we need to talk and eat. So it's very small doses around the mouth, And because it's such a low dose, it doesn't last very long. So when people want lasting results to their lips, I really am usually talking about fillers, although happy to do Botox for the right patients. And I have an entire podcast episode on lip enhancement that goes over fillers and Botox in the lips. If you're interested, check it out. Now I'm going to switch and talk about the different toxins that are FDA approved as of today. We are in early 2024. I will go in order of their FDA approval and realize they are all FDA approved for the glabella. That's the area between the eyebrows. They are not all approved for the forehead and the crow's feet at this time, although some of the companies are working on it. But I think it's fine to use all of these toxins all over the face. I am completely fine with that. When we started using Botox, it wasn't FDA approved for any of these areas. So let's start with Botox, brand name. I love Botox, as you can probably tell. It is my favorite toxin. There's a whole podcast episode on Botox basics if you're interested, but briefly, it's been FDA approved for many years. It usually lasts about 3 to 4 months, typically, and it works fantastically to reduce lines and wrinkles on the upper face and also in the non-FDA approved areas that I just mentioned. Botox Cosmetic and Botox are the same exact thing in 2 different packages for insurance billing reasons, since Botox is FDA approved for many, many dozens of indications for medical uses, including for migraines. And I often find that my cosmetic Botox patients get fewer headaches and migraine relief just from their cosmetic Botox. But on occasion, I share patients with the neurologist, and I always tell patients to go to the neurologist first, get their Botox for their migraines, and see me 2 weeks later so that I can try to touch it up and make it look good after the migraine protocol has kicked in. Or I can add it to other areas that they might need for cosmetic use. But I like to do those on a schedule 2 weeks apart and not have the patients just randomly doing their Botox here and there to try to avoid developing antibodies to Botox. This is a very unfortunate thing that can occasionally happen. It's rare, but when it happens, it's typically to patients who have had very high doses for medical reasons, but on occasion it can happen to a Botox cosmetic patient where the Botox just stops working. This means when it's injected, it has no effect at all. Not that it doesn't last, not that the results are not as good as the patient thinks they should be. It literally has no effect at all. And unfortunately, if this happens, it does seem at this time that none of the regular toxins that I'm going to mention are going to work for the patient because these are all versions of botulinum toxin A. There is a botulinum toxin B. It is called MyoBlock. It is, at this time, not that easy to obtain, afford, or get to inject. I've heard it's very painful, and I have not had the occasion to get MyoBlock in my practice at this time, but for patients with antibodies, that is what they would be looking for. So after Botox came Dysport, and they had wanted to call it Relaxin, which would have been a much better name for marketing purposes, but the FDA made them stick with Dysport, which is what the name was in Europe at the time, where it was already approved. Both Dysport and Botox are varieties of botulinum toxin A, and they both have proteins wrapped around them of different sizes and different types. Their units are different, but they do the same thing and have the same effect. There was some thought that Dysport worked faster and lasted a bit longer, but I have not found that to be the case in clinical practice. And while brand name Botox is my favorite, I use Dysport all the time, mostly for patients who came to me already on it. I've been using Botox brand name for just so long, I just prefer it. And I also use the tiny doses in all these different areas. And I just find that I feel more comfortable with Botox in those areas since I've been doing it for so long. It is true that sometimes different toxins have different effects in different people, and one can work better in one patient than another. And so I do like to stock a few different types for patients who are having difficulty, but that is rare. As to the differences, I would say that Dysport is known to move a slight bit further away from where you put it than Botox does. So again, that's why when I'm doing the tiny doses, I just prefer brand name Botox. But there is absolutely nothing wrong with Dysport. It works great. I would also like to state some injectors only stock one toxin, and that is fine. I stock 4 of the 5 that are FDA approved in my office, but I do a lot of toxin injections, so that makes sense for me. Moving on to the next one, after Dysport came Xeomin, and Xeomin branded itself as the naked toxin because it has no wrapping proteins around it, so they say it's supposed to be pure. The bottom line is all three of these, Botox, Dysport, and Xeomin, basically have the same effect. I have not noticed any significant major differences between them, whether they have wrapping proteins or not. But I have some patients that prefer Xeomin for that reason, or they came to me on it. The units for these are fairly different between Botox and Dysport. Between Xeomin and Botox, they're more similar. It's a little easier math conversion. And I like Xeomin. There's nothing wrong with it. It works well. There was a bit of talk that maybe it didn't last as long as Botox, but as far as I can tell, I think it's really the same. So I try to explain to people that the different toxins are kind of like Coke and Pepsi. They are baseline the same, brown, sweet, fizzy liquids that people drink, but some people like one more than another, and that's how I view the different toxins. Brief mention for Jeuveau, which got FDA approved 4th. This is yet another version of botulinum toxin A, and I just saw no point in bringing another one in since I already have 3. So I do not stock that one, but I did try it when it first came out. It absolutely works. There's nothing wrong with it. I never have patients asking me for it, so I just don't bother to stock it. I do have people coming in asking for brand name Botox or Dysport or Xeomin, so I like to definitely stock all of those 3. Recently, we finally got Daxxify, officially known as Daxxify. This was supposed to be revolutionary and was supposed to be a big improvement as it got FDA approved for 6 months. The other ones are really 3 months, at best 4 months. So if it's FDA approved for 6 months, that would mean patients would only need to come for their injections twice a year. That is a vast improvement over having to come 4 times a year. And people would love that. However, as it turns out, the FDA approval for Daxxify is 6 months on average, which means that for some patients it's longer and for some patients it's shorter. And their claim to fame is that they package their botulinum toxin A with a positively charged peptide protein that is supposed to stick around and somehow make it bind better and last longer. Do not ask me to explain the basic science. It is proprietary, and they do not share it with us. But the bottom line is, in clinical practice, the results have been variable. So it did not really blow open the marketplace, and it's 6 months for everybody. No, some people that tried it in my office, it lasted not as long as their Botox, which was 3 months. Some of my patients like it, so they stay on it. I stock it for the people who want it, and that's fine. It works well. It's a nice toxin. I don't have as much long-term data of use since it's only been around a shorter amount of time, maybe a year or so. We thought it was going to be better than it was, but it works fine. It's just not a runaway, fantastic improvement over what we already have. So that's it. I hope that this was helpful for a session on advanced Botox. I tried to cover the off-label areas, most of which I do, some of which I don't. Some of them will be on label soon. And I also wanted to review the current FDA-approved toxins in the US. I do think more will be coming, so we'll have to wait and see what those bring. But for now, I'd say brand name Botox is still my favorite, but they all work great. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.